Hi everyone, my name is Flores Luo, and I'm here today to share with you a new medicine called Entresto. Entresto is a fixed-dose combination medication for use in heart failure. It is a mixture of two substances named Sacubitril and Valsartan, and their molecular formulas are shown in these pictures. So, how is Entresto discovered or invented by the scientists? In fact, back in 1980s, neprilysin inhibitor, one of the components of Entresto, was already developed as one strategy against heart failure. In 2001, according to this strategy, a new medicine named omaveloxolone was developed by Bristol Myers Squibb, and it quickly became a leading drug candidate for the disease. However, due to the high possibility of swelling in blood vessels caused by the medicine, which can lead to suffocation or even more severely, death on human beings, omaveloxolone was not put into clinical use. Then, Novartis continued exploring this strategy, and they developed Entresto. On March 31, 2014, Novartis announced the completion of its landmark PARADIGM-HF trial, a clinical trial on efficacy and safety of the drug on patients with chronic heart failure. Finally, on July 7, 2015, Entresto was approved by FDA in treating heart failure. Now that I've talked about the history of Entresto, it is time to move on to next question. Why? Why can Entresto help cure heart failure? Well, to explain it clearly, I'll begin with how our body controls organs like the heart. As is known to all, the feeling and movement of organs are mainly controlled by our nerve system, which mainly consists of nerve fibers. At the end of the nerve fiber, the neuron secretes a chemical called neurotransmitter. It will then bind with a special kind of protein, also called a receptor, on the membrane of its target cell. Then, the combination will start a series of chemical reactions inside the cell by generating new chemicals called messengers. These reactions cause different results. In this way, the nerve system is able to conduct all organs in one's body. The same thing happens to our heart and its blood vessels. Now, as you can see, there are certain types of receptors on our blood vessels named AD1 receptors and MR receptors. When they receive certain chemicals from the nerves, the former will cause the blood vessels to contract, while the latter cause inflammation and fibrosis. But when Valsartan, one component of Entresto, combines with these receptors, it stops the chemicals from binding AD1s and decreases the chances of chemicals binding MRs, thus reducing the corresponding results they bring. So, to some extent, this medicine actually helps dilate blood vessels and reduce inflammation and fibrosis. And this, in turn, allows more blood to be ejected from the heart and less damage done to our cardiovascular system, thus relieving symptoms of heart failure. Apart from what is mentioned above, Entresto can also ease the symptoms by preventing one type of messenger from being broken down. This messenger, also called as cGMP, can dilate blood vessels like what Valsartan can do. It can be broken down by certain enzyme. Sacubitril, the other component of Entresto, protects cGMP by protecting the enzyme inhibitor called neprilysin. That is why Entresto is sometimes called ARNI, or angiotensin receptor neprilysin inhibitor. Then, I'll briefly talk about how this medicine is transported inside our body once it was taken by the patients. Once taken orally, The complex dissolves and reaches the highest plasma concentration in about an hour to 2. Here, plasma means blood without blood cells in it. The complex is bound tightly to the plasma proteins for further transportation. Sacubitril is easily broken down by certain enzymes, whereas Valsartan can hardly be broken down. Most of sacubitril is expelled in urine followed by feces, and most Valsartan is expelled in feces followed by urine. Finally, I'll introduce other uses of Entresto and its side effects. As is mentioned above, Entresto is a medicine developed for heart failure, especially for those whose hearts can't pump enough blood out into their blood vessels. However, due to the fact that it can dilate blood vessels and reduce fibrosis, this medicine is also used in treating hypertension, cardiac arrhythmia, primary pulmonary hypertension or PPH, diabetes, and renal insufficiency. Although Entresto is efficient in treating heart failure, it still has side effects. For example, people with renal insufficiency may have hypotension or low blood pressure and hyperkalemia or high concentration of potassium in one's blood. Other side effects also include dizziness and deterioration in serum creatinine. So, people who have fundamental diseases related to these side effects must consult their doctors before taking the medicine. The bursts of Entresto provide people who have heart failure with a glimmer of hope, but they have to use the medicine under the guidance of professionals to prevent side effects to the greatest extent. Thank you for watching my video. Take care, and may health be with everyone in the world.